okay? Good. All right. Okay, so I'll share my slides to begin with. Has everybody managed to get onto the Moodle site and got the tutorial resources? Because you will need that in a few minutes as a couple of activities to do today, and I'll put you into it'll be pairs rather than groups. But before we do that, I'll share my screen and we'll work through that. At least I will try and share my screen. Why is it not sharing? Oh, there we are. So hopefully you can now see my slides. There you go. So we're going to be looking at experimental design. And one of the reasons why we might want to do an experimental design is that we're actually wanting to find out or to understand the cause of a particular behavior, or we're wanting to test a particular intervention. So we've designed this intervention. We want to know whether it actually works for anxiety. Now, we can get a lot of descriptive information about the benefits, but we can't necessarily allocate them to a cause or a causal allocation. So what we might want to do is we might want to select 100 people, do a bit of a pre-test for anxiety. 10 people don't have it, let's say right, we don't want you, but that this other 90, you're all right, you're over a certain level. We'll randomly allocate you to an educational program or an intervention, a green pill intervention, and then we'll do this, and then we'll see what your anxiety levels are before and after, an hour a day or an hour a week or whatever, and then we can determine whether or not a particular intervention or the orange pill or whatever it might be actually works. So that's really why we might want an experimental design, and the benefits of it is because we're now trying to determine whether there's a particular cause of a particular behavior, rather than just trying to understand what it feels like, or not just because they're just as important, but rather than trying to understand what it feels like or what the what's going on for individuals. To do this, there's a few things to think about. One is that we are going to be manipulating what we call the independent variable, which I'm sure you're all fully comfortable with now, having been through the lectures and the tutorials up there, and so that we can measure the changes in the dependent variable. One of the best ways of ensuring that we can minimize the effect of bias is to make sure that we randomly assign, I prefer the word participants, but I know the book uses subjects. But anyway, randomly assign participants to particular groups, an experimental condition, and some kind of placebo or control kind of group. So we got two groups going through the process, and we're measuring before and after. But the other thing we need to take care of is extraneous variables. So if you imagine that same experiment, that sort of, we've got the two groups, we're going to do one an anxiety intervention, and one we're going to put through we'll tell them how to manage, or stress intervention, telling them how to manage their stress. If the group doing the anxiety intervention happened to come into the lab, and the lab was very specially designed, very relaxing atmosphere, there's a bit of nice relaxing music going on in the background, but the group who were having the education experience were in a classroom somewhere, and they were watching a TV doing it, and there's lots of other people in the same room, you couldn't necessarily say, if there was any difference in the outcomes, that it was the intervention that worked, because in fact it could also be the fact that the relaxing music and the relaxing atmosphere was what worked, and not the intervention you utilized. So sometimes these extraneous variables can have quite serious effects or implications for the study, and there's no way in that instance that you can confidently say that the intervention worked, because it might actually had not worked at all. It's just because the two groups were in two different environments that made the difference. Does that make sense? Any questions so far? No. Okay, good. So we need to understand what these extraneous variables are in order to, the best we possibly can, manage those ones that are potential confounding variables, the ones that are going to mess up our results, so we can't actually link the results with the experimental, with the kind of intervention we've designed. So what we're going to have to begin with is an activity, and I'm going to put you into pairs, I think it's going to be now. And there, if you look on your slides, slides 7, 8, and 9, there's experiment 1, experiment 2, experiment 3. So breakout group 1, if you do experiment 1, group 2 or pair 2, you do experiment 2, and pair 3, experiment 3. Okay? Now what I want you to do is go through it, and we'll see if you can work out what the independent variable or variables are, what the dependent ones are, what the confounding ones might be, and then to come up with some kind of method to minimize the effect of the confounding variables, or even to unconfound the experiment. And then we'll get back together and we'll discuss and work out where you got to and how well you did. Does that make sense? I'm going to stop sharing now. Any questions before I shuffle you about and put you into rooms? Oh, Brittany's here as well.
Yeah, hi, Eric. So on my notes, I've got experiment 1, experiment 2, and experiment 3.
Correct.
So if we're doing, say, for example, independent variable, it's across each of experiment 1, experiment 2, and experiment 3?
No, I'm going to put you into 3 rooms. And so room 1 will use experiment 1, room 2 will use experiment 2, room 3 will use experiment 3.
Gotcha.
Yeah?
Okay.
Does that make sense? Yep. Any other questions? Okay, there's a chat thing there. Okay, fine. Brittany, are you there? Can you hear us? Not sure. Okay, I'll keep that in mind when I... Right, I'm going to put you into 3 rooms now. So room 1, experiment room 2, experiment 2, room 3, experiment 3. Off we go. You should have your invitations. Now. Okay, invitate, yep, good. Brittany, are you there? Brittany, can you hear me? Brittany? Are you there, Brittany? Brittany, you there? So just waiting for the other two. And so if you answer your exams like that, you're bound to get the questions spot on. Oh, hi, you two. We've just had a big discussion about the exams whilst we were waiting for you, but we're okay.
Oh, thanks. Great. Good luck, everyone. Yeah, hope you all fail. No.
Yeah.
Just kidding, just kidding.
Well, we can't because we know all the answers now. You missed
it's coming towards the end of the semester, so what
exactly.
to do, eh?
That was another one of, yeah.
Okay, right. So what I'm going to do is I'm going to share my screen so others can read, and I'm going to work from whoever was in the first experiment through to the second and third. So if I can share my screen first, that would be quite useful, wouldn't it? There you go. So who was breakout room 1? So whilst have a quick read of this, everybody else who hasn't had a look at it, and in a second or two I'll ask, who was it? Was that you, Paul? Was that you, Paul? Was it? I can't see everybody at the moment, so I could see Kathleen, Paul, and Sarah only. So
it was Caitlin and myself, but Caitlin desperately wants to explain.
Oh, does she? Oh, that's great news.
She said to me, Paul, please don't speak. I really want to speak. So I said, okay.
Where are you, Caitlin? I can't see you.
I am here. I'm always here.
Yeah, but it's... Oh, there you go. Gotcha. All right. So, Caitlin, share with us your independent, dependent variables, confounding variables, and your excellent resolution.
Yes, I would desperately like to do that. I actually threatened Paul with physical violence if he didn't allow me to take full control.
Oh, very good.
Okay, so we identified the independent variable of this experiment to be, oh, Paul, you're actually better than me at this bit, the incoming planes being received. Is that right? I feel like that's right. Yes, okay, he's nodding good. And the dependent variable to be the attention span of the air traffic controllers, which we're measuring using the amount of errors that the air traffic controllers made.
Yep.
Cool. Confounding variables identified. So we identified things that are completely outside of the scope. So, you know, have the air traffic controllers eaten properly? Have they slept enough? Are they mad? That kind of thing, as well as more relevant factors such as the weather, because obviously that affects air traffic control pretty drastically, as well as the experience of each individual air traffic controller. So what if you've got someone who's been doing it for a month, someone who's been doing it for 10 years? That's going to have an effect.
Having said all that, though, they are randomly selected and randomly grouped into different ones. And it is a computer terminal. It's not out in the real weather. So, but anyway, that's very good. No, that's very good. Yeah, excellent. Well done. Carry on.
I was a bit confused by that actually, because they're at a computer terminal, so it's a simulation. But then it also says that the air traffic controllers are tested without their knowledge. And I'm like, surely they would know if they were in a simulator as opposed to the real world. Like, that was a question I had. But anyway, I don't know that that's relevant. I don't think so. Looking at a method to unconfound the experiment. So we discussed the potential for those further dissections. So yes, we've randomly selected them, but I believe that it's relevant for us to look at the experience of the air traffic controllers independently and make sure that it's evenly spread before we start saying 6 flights. We also noted I think it fits into a method for unconfounding the experiment, but just that I see you've changed the slide on me now.
Oh, sorry.
But just that, so they've said no errors occurred when 1 to 3 planes was incoming. However, they could handle up to 6 with non-fatal errors. And then they've concluded that they should never coordinate more than 6. And Paul and I both agreed that when it comes to air traffic control, the maximum amount of errors should be 0. So they should really have stopped at 3, where they know that despite any confounding variables, no mistakes were made from 1 to 3 plans being handled. So another way to unconfound it would be, well, okay, if we can't redo the experiment, stop at 3, not 6.
Okay, very good. However, there's a little bit of a nifty little thing in this design. Can anybody pick it up? Anybody read it?
So hard.
Yeah, I know. Nobody's got it so far. But if you look at the actual research design, you did actually talk about it when I disappeared.
Yes, we did discuss this. I didn't summarize this then, but we did say how we should randomly variable the amount of flights. Correct. We did talk.
So, because in essence, if you think of the design, they're very fresh, just come in, no problems, and they just get 1. Then they get 2, then they get 3, and they're getting a little bit tighter, then they get 4, getting a little bit tighter, and they get 5, a little bit tighter, and they get 6. So they might actually be able to do 10, no problems, if they gave them 10 at the beginning and said, here's your 10. Oh, yeah, no problems, I can do this easily. So in fact, there's no, they might be able to handle all 10 if it's just for a short period of time. It's just the way the designer's got, the tighter they get, the more they get. So it might actually be, it's a false assumption in terms of their what their controller has made. But excellent, guys, very well done. Okay, so who was experiment 2? I can see a hand and the top of a head, that's Kathleen. So who would like, have a quick read of this, everybody else? Well, are you going to share, Kathleen? Are we?
Yeah, I don't mind sharing.
Yeah. You were with Mahidya, weren't you?
Yeah.
All right. So what did you get for your independent and your dependent?
So the independent was the new drug. So some people were given the experimental drug and some were given a placebo. And we had the dependent variable as the nurse's observations of depression or symptoms of depression.
Very good.
The confounding variables, we had a few. So each of the nurses may have had a different set of, like, a definition or idea of what symptoms were.
Yep.
So one might think someone's more depressed and someone might think that same person is less depressed.
Yep.
We also had the nurses' schedules would have been quite different. What if they had a day off? Who was going to administer the drug? Did they know which drug? And the setting for all the patients would have been very different. They would have been surrounded by different people and sound.
Yeah, yeah, very good.
Things like that.
Yeah. Okay. Yep. Excellent. So yeah, I'd agree. The treatment is the independent variable. It's a experimental versus control group. Experimental with the drug control, and the observer ratings. The observer ratings, everybody else, if you haven't had a chance, particularly the observer ratings is relevant because there wasn't a standardized, validated test of behavior. It was about the nurses observing the behavior. So that's why observer rating is the dependent variables. It's not and how that might change depending on whether they get the drug or the placebo. Of course, the downside of that is that individuals, as they very rightly pointed out, might have different, two different individuals can watch the same set of behaviors and have different assumptions, different ratings, and so forth. So one of the things you could do as a result is you could get both nurses to observe everybody, but not necessarily understanding. There could be a double-blind randomized process where the nurses don't actually know whether the patient has a placebo or the drug. and then they observe what's going on. So they don't actually know which one they're observing. They have no clue. They observe as they go through, and then those results can be analyzed by somebody else, and the drug could be given by somebody else. Does that make sense?
Yeah.
Yep.
Nahidia and I had also thought that there could have been the use of a questionnaire prior and post-treatment.
Yep.
Rather than relying on observation alone.
Yeah, so you could have something like that as well. Yeah, excellent stuff. Very good. Well done. So experiment 3. Have a quick read of that. And who was experiment 3?
That was Marisi and I.
Oh, that's right. Yes.
Mm.
The truck driver one.
Yeah, that's right. Yeah.
Over to you, Sarah.
You're fired, Eric.
So what was your notion of independent, dependent, confounding, etc.?
So our independent variable was the attitudes of people towards child rearing. Did I get that wrong?
Yeah, I'm listening.
Oh, sorry, I thought someone sighed. The dependent variable was the course and whether or not people, there were some that took the course, some that didn't. So the course on child rearing was the dependent variable, and the confounding factors we came up with were the participants' pre-existing attitudes towards child rearing or families, perhaps where they had come from themselves or whether they had children themselves, and the fact that the people that were doing the course chose to do the course. So they would have had an interest.
Anyway.
They had an interest anyway in child rearing.
Yeah, yeah.
So a way to unconfound this, we thought that there could be more of a random group in terms of randomly doing the course, irrespective of their family attitudes, or identifying the attitudes to begin with, and then selecting people to take part or not take part in the course, and then assess that afterwards.
Yeah, so you could filter people, based on, well, you've already got very strong opinions, so let's find people who don't have neutral opinions or whatever, and then we can collect 100 people of those, do a volunteer thing, and then we can randomly assign them to doing the course or not doing the course. Excellent, very good. Wonderful, everybody. Oh, there's a really, I don't know what that noise is, but it's oh dear. Okay, we're going to move on to the next one now. That's very well done, everybody, by the way. That's excellent. So you clearly know, I mean, of course, if you are going to do these things in real life, you get more than 10 minutes to design an experiment. So for a 10-minute process, you did very well. But what I'm going to be doing now is giving you 10 minutes to design an experiment. So the background of this issue is stress and so forth is growing because of the interconnectivity, online, computers, smartphones, etc. And to the extent that a stress and well-being survey in Australia recently found that 44% of the 1,020 respondents rated a workplace as a source of their stress and had high levels of stress. There are lots of interventions that are happening at the moment. Relaxation meditation seem to be quite good at that. There's this new virtual reality program called Sound Self, which does actually exist. Which was created specifically to allow people to utilize it through their lunchtime and in different ways. It's been proposed as pretty effective for relaxation for students and workers. So your job is to design an experiment to test the efficacy of the Sound Self program in reducing stress. And you need to consider things like, what kind of design you're going to have, who the participants might be, how you're going to select them or collect them, what materials, procedures you might want, what are the internal, external validity threats, what are the practical constraints, etc. That's all on your slide, so I'm going to stop sharing now. Are there any questions before I put you back into your groups? Easy peasy? It's now 8 minutes past. I'll give you till somewhere between 15 and 20 minutes past, depending how much time we want to discuss it afterwards. maybe 10 minutes. Maybe if we have 10 minutes to discuss, so I'll give you maybe up to about 18. So I'll give you about 10 minutes, okay? Good stuff. And I'll put you back into your rooms and come and check everything's okay. Your invites are out. Brittany, are you there?
Hello. What did we miss out this time, cheaters?
No, we only just got back as well.
You really fought to hang on in there, didn't you? This one, everybody waited the last second before coming back into the group.
We were pondering if I can cite Aristotle in one of my argumentative essays, and then we realized he probably hasn't written any journal articles. So yeah, that's where we were at.
You could do if you can find something written by Aristotle.
Yeah, that was the problem. I was like, well, this is a concept that was birthed by Aristotle, but I don't have like a literary journal that Aristotle wrote that I can cite. So yeah, too in depth.
Yep. So who would like to go first? What did you get to? What were your designs like? Who would like to share first?
Paul told me that he was absolutely dying to go first.
Oh,
and he
that's
said
nice
that he
to
wants
know.
nothing else.
Go for it then, Paul, seeing as you're so keen, that's fine. You got to turn your mic on first, though.
Yeah, that would help. That would help. No, thanks, Caitlin. I know now not to give you a hard time. Okay, so we had as our independent variable the sound self program, and the dependent variable being the 44% of the workplace that indicated stress as it relates to work. We originally thought, well, look, that 44% relates to a particular workplace, but then we realized that the 44% relates to the entire workplace. So it would be very difficult to have a sample of the entire 44% of the entire workplace. So we felt like we needed to break that down and get a cross-section of the workplace and randomly assign, that 44% into groups, one of which is a control group, and one of the groups is to do the sound self program. So roughly 50-50 in terms of the groups. We noted that lunch breaks and the middle of the day were important watch outs in terms of where they are and their stress levels. So we felt like lunch breaks was an important time to be able to introduce the sound self programs. Obviously lunch breaks, being there 60 minutes, we felt like 30-minute lunch breaks would be more than enough because people have to eat as well. So 30 minutes, we went back and forth in terms of how long we should do it. Should we do it 2 weeks? Should we do it, after 3 days, should we redo it? We felt like we needed at least a few weeks to give it time for the Sound Self program to get some traction and then compare it to the control group. With the control group, we kind of went back and forth in terms of what the kind of mechanism we should have in place for the control group. Was it just people getting together to have a chat about their work or something? But in any case, we just wanted to make sure it was a true control group.
Yeah, I mean, one of the things that's a really interesting discussion, because if you think about some of the other things, one of the things you might want to think about is the sound safe mechanism. Now, if it's virtual reality, it might be one of those things that you wear, in which case you might need to, as much as possible, get your control group to be in a very similar situation, wearing the same kind of stuff. But you might have an educational thing on there that teaches them how to manage stress rather than the actual program, something like that. Yeah, very good. Excellent.
The only other thing, we did discuss internal and external validity. I don't know how far or how meaningful our discussions were in regard to internal or external validity. From an internal perspective, we at least acknowledge that everyone's going to know that the testing is on, and they're potentially going to know they're in a control group or not a control group. So that's something that could potentially be an impacting factor in regard to validity. External validity, we kind of talked about the fact that it was kind of in real time in terms of it's in their lunch breaks, it's at their workplace, it's true to the environment that they're having the stressful experiences. So we felt like that lent itself to being valid in at least that sense, but we probably didn't get too much further than that.
That's excellent. Well done, guys. So who would like to add or put anything different to that, or any other ideas that people would like to share?
Lydia and I were talking about some of the practical constraints.
The what, sorry?
So the practical constraints.
Oh, yes, yep.
So we thought similarly about like virtual reality, you tend to have that headset type of thing on. It can be quite expensive and big equipment to have around. So that was one thing, and it also can be quite expensive to run it. So you probably wouldn't want an intervention or a treatment that goes for too long.
Yeah, no, that's a really interesting point, because depending on, I mean, if it was just like a piece of software on a computer, you wouldn't really matter. But if it was actually required physical equipment, then you might actually need to bring people into the lab, mightn't you?
And we also sort of thought in terms of time, like I wouldn't want to give up my lunch break to do something like that, because I actually only get a half an hour lunch break. Whereas if it was done during work time, your employer might not want to give up half an hour of your paid time to do something like that. So we're sort of thinking like this.
Yeah, so you might end up with, actually, like a lot of research does in psychology, which is one of the reasons why you nearly always end up with students, because it's much easier to manage that time than than people in real work context, which then that sort of says, well, okay, this might work all right for students if you can bring them in the lab because the equipment's worth $30,000 each piece, but has other issues then with regards to ecological validity, doesn't it? Because it may or may not work in the workplace. Yeah, excellent, good.
And another thing that we talked about was that we think that their level of stress would need to be measured at the start of the day. They need to undergo some kind of a treatment during the day, and then they need to be measured at the end of the day, you to actually assess if SoundSafe is working, doing anything or not.
Yeah, and comparing that with the whatever control you've got. Yeah.
And we had thought that maybe the control group could do a similar kind of activity with a headset where maybe they were listening to some music or a TED talk or something for 10 minutes while someone else is doing the virtual reality.
Excellent. Very good. Some nice ideas there, guys. What about who was it? That was Marissa and Sarah, the last, well, not the last two, but the final two to talk. Let's put it that way.
We mentioned that something that else might interfere.
Oh, Marissa, you've gone.
Oh, okay. So
Over to you, Sarah.
Yeah. One of the things that we mentioned was the medical aspect of things. We would need to do some kind of deciphering people's medical conditions, because things such as epilepsy, maybe even autism or anything along those lines, some of the images may affect people differently. So some kind of medical screening.
Yeah, very good point. Yeah, that might be when you actually do your request, you know, for participants, you might want to do some filtering, some screening to make sure. You might only, not just because you want to make sure from a medical perspective, but also you probably want people who are stressed. There's no point, you know, you might have 200 people saying, yes, I'll do it, but if only, you know, you might only end up with 100 who are actually in a position to be utilized, because there are only 100 that are stressed. The rest are having a whale of a time. So they could be a confounding issue as well if they're not actually stressed. Yeah, very good, excellent.
Can you hear me?
Yeah, we can now. Yep.
I think I lost you for a second, but I don't know what medical issue Sarah mentioned, but we were talking about if participants had a physical response or physical reaction, like having seizures, etc. Sorry, Sarah, I lost you.
Yeah, no, that's absolutely.
Okay, great.
Yeah, so anything else from you two that you want to share?
I think it was generally covered.
Yeah, no, that's excellent. I wasn't expecting it, just in case I didn't want to butt in. Sure. So that's really, really good, guys. That's absolutely excellent. It sounds, when I've listened to everybody, people had sort of very similar ideas and were thinking of different issues around it. So, but you can start to see how just a little thing like that can be quite complex, especially if you're trying to do something which is ecologically valid as well as everything else as well. And sometimes you may not be able to do it. You might actually have to say, well, in this instance, I have to do this in a lab. This bit of equipment, I've got 10 of them and they're worth 30 grand each. There's no way I can go out and take them into somewhere else, and we're testing because it's a prototype or whatever it might be. But then it's trying to do the best you possibly can with within the context and the situation you've got. Excellent, everyone. So this is our last one next week. Are there any questions before we say goodnight, or is that okay? Wonderful. Well, have a great week, and I'll see you next week. Bye.
Bye.